Good morning or afternoon, depending on where you are today. My name is Andrew Colasar. I'm a partner at Thompson Hine. I hope you are staying well during these difficult times. Welcome to the webinar discussing environmental health and safety issues during the COVID-19 pandemic and beyond, sponsored by Thompson Hine, Tri-Hydro, and Goldenberg Schneider. I'd like to start by introducing our speakers. We are pleased to be joined by Scott Stoner and Carrie Ramirez, who will give us COVID-19 health and safety insights from inside the ropes, so to speak. Scott is a director of EH&S for Stanley Black & Decker, working out of Stanley's Indianapolis facility. Scott has over 34 years of EH&S experience, which in addition to Stanley includes many years in the automotive industry. Carrie Ramirez has 18 years of experience in EH&S management at General Motors. In Carrie's current assignment, she leads validation activities for global workplace safety. During the COVID-19 pandemic, Carrie supported GM's North American warehouses, developing and implementing methods aligned with CDC and state guidelines to safely return people to work. Steve Axtell is a partner in Thompson Hine's environmental group working out of our Dayton, Ohio office. Steve has a broad practice with a focus on environmental compliance, chemical regulation under EPCRA, TSCA, and FIFRA, and representing clients in OSHA enforcement matters. Ted Schneider is a partner at Goldenberg Schneider in Cincinnati. Ted will be speaking about remote auditing in the COVID-19 era. Ted and the Goldenberg Schneider law firm have performed roughly 5,000 EH&S audits throughout the U.S. and globally during their 25 years in business. Ted began his career as an environmental engineer, went to law school, and continues to provide environmental and technical EH&S services to his clients. Ted's practice group is made up of attorneys who also have technical degrees and backgrounds. They focus much of their effort auditing EH&S and DOT programs and solving compliance problems. And finally, Rajiv Sinha is a regional manager from Tri-Hydro Corporation in Cincinnati. Rajiv is a chemical engineer with more than 30 years experience with a host of environmental issues, including site investigations and remediation. Tri-Hydro handles complex environmental and engineering challenges with a focus on petroleum, mining, water resources, industrial, commercial, and infrastructure sectors. Tri-Hydro has provided services in all 50 states, Puerto Rico, and several foreign countries. And I'll mention that Thompson Hine is a full-service law firm with approximately 400 lawyers in our Ohio offices and New York City, Washington, D.C., Atlanta, and Chicago offices. During the webinar, please feel free to use the question box located in the control panel to the right side of your screen to submit questions. We will answer some questions at the end of each presentation and also at the end of the webinar. If we don't get to all the questions, we will respond via email after the webinar. The presentation and other information is located in the handout section, and we will record the webinar and send the link to all attendees early next week. Thank you very much for joining us. I'd like to turn it over to Scott and Carrie to get us started.
Thank you very much. This is Carrie, and I'll be tag teaming with Scott a little bit on each slide. The thing you probably should know is that although we're from two very different companies, at a very basic level, we had some very similar challenges, and so we worked together to sort of highlight some of those as we went through. If you want to go to the next slide, that would be great.
Yeah, this is Scott. I just wanted to make a comment too that Carrie and I compared notes as to what we were doing at General Motors, what we were doing at Stanley Black & Decker, and it's as if we were in two parallel universes because we were doing many of the same activities. Go ahead, Carrie.
No, that's a good point. Thanks. And we are tag teaming on this, so we'll jump in on each other at any time. So the first comment was just that we all, or at least most of us, I think, started with a pandemic plan. In the case of General Motors, we called it an infectious disease plan and coupled it with our corporate emergency response plans. And they fundamentally looked the same, again, at a basic level. You know, we're trying to be prepared for when people are coming in with illness, when we have to manage that in the broader areas where we're working. I think there was a general recognition of the fact that there'd be a phase to this, that depending on the extent of the pandemic, we would be able to do different activities across the board. Having said all of that, I'm not sure that we really anticipated what it would really look like in real life and how it would really work. Because the other thing that we had to get involved was collaborating groups and following government guidance. So as much as we could put our thought into the plans to begin with, the real life factor of it was that not only did we have to get our facilities groups and our environmental health and safety groups involved in the actual execution, but you also had really broad discussions with the associations you're a part of within your manufacturing sector or within your group. You also had union discussions to get in there, and of course, public health directives and government requirements at the state and local level were important as well. Your turn.
I'd like to say too, you know, Stanley Black & Decker is a global company. We have operations around the world. And when this first broke out, we knew that this was a major issue because of our Asian facilities, the ones we had in China. And as the virus went around the world, it was almost as if we saw a tidal wave coming on us, and you're helpless. You know it's coming. As it came around, we were talking to our colleagues all in the Asia APAC region, and then in the European zone and European Union, and then it came finally over here. So to Carrie's point, we had a plan. We thought we knew how to do this, but having never done this before, it really opened us up to really just putting a plan in action. You can't really you can think you're ready, but you're really not until you actually live it, I guess.
Yeah, that's an excellent point. Yep, next slide. Okay, so this is where the note comparing came into play, and we realized that we have a lot in common. So here are some general topics that we had to cover, and we're going to go into some of the hurdles we faced for each one, but the idea was a multi-layered approach to be able to get people back to work safely and keep them here, and then be able to manage any cases that popped up along the way. So what that really meant was big decisions about getting PPE and how we're going to wear it and who's going to wear it, figuring out how to clean, disinfect, and sanitize in the best way possible with the resources we had. Temperature screening, and that's really the physical point of getting them through the door and what that would look like. Then trying to figure out social distancing. So the regular challenge on an assembly line is that many people work close together. So it was really a look at every single job across the way to figure out what can we separate and what can't we separate, and what do we do about the ones that we can't. Screening questions go along with the temperature screening. Is how do we make sure that if there's no symptoms there and we can't check the symptoms, how do we do our best to, again, keep the virus out and make people aware of possible risky activities that could expose them. And then, of course, once we get into the COVID cases, how are we going to manage that? Not only to support our employees who are ill or dealing with an ill family member, but also how do we make sure that it doesn't spread, that we do decent contact tracing, and that we manage whatever cleaning and aftermath we have to manage. And a big piece of that is training and communication, getting employees to understand what we need from them and what we expect, but also making them feel safe, trusting what we have to say, making sure they're willing to communicate with us when things happen, you know, and making sure that we're being as transparent as we can given limitations of certain record keeping requirements such as those under HIPAA. Scott?
Yes, and there were challenges with this. First of all, getting the PPE available for us in the United States. That was a major challenge. So we're getting the masks here, also getting them in the European Union. If they weren't CE marked or they weren't labeled properly, you couldn't distribute them. So that was a challenge. Temperature screening, some of the scanners would actually do facial recognition. So we had to make sure that there was no facial recognition software being employed as we would take the temperature for our employees, so that we honored all the privacy issues and privacy concerns. Screening questions. This is difficult. We would ask what kind of activity you went on vacation. Well, exactly what did you do? Did you do high risk activities which could have exposed you to the virus? What did you go to Disney World? It's been closed, but something like that. Did you go to concerts where you were out, out with lots of people? And then again, that has its own set of challenges because we don't want the virus in the workplace. And employee training and communication, you cannot over communicate your message to employees. We did this through a variety of ways, through online training, webinars, internal, and making sure that we got the communication out to employees. And I'd like to say, and here again, Carrie and I had very similar results. Very, very, very few cases have been transmitted internally at our facilities. I'd say the vast majority are brought into the facility from people going to visit a relative who's sick with COVID, or at a family reunion, or at a golf outing, or things that they were doing outside of the plant. Next slide.
Yeah, as we're going to the next one, I would have to echo that. We have, to date, we have one case that's internal exposure. The rest have all been external exposure. So, what we're doing seems to be working, but it does take a lot of effort and a multi-layered approach. So this next slide is talking about the mask hurdles, and Scott already covered some of them in terms of availability. I worked through the entire shutdown, of most of the world. And in that time, we saw mask availability change dramatically from we just couldn't get them to we could let people bring in their own to we now have a couple of N95s or surgical masks to now, at this point in time, we're fully stocked. What you might find interesting is that you may have heard GM is making their own masks, and as of yesterday or the day before, our masks received the N95 certification, or at least a portion of them did. But interestingly enough, we are not using our own masks. We are actually buying them from out of the country because those masks are have been given to the government for distribution to hospitals and other places around the country. Besides just availability with the masks, the other situation is how do you get them to people safely? So in the GM case, we want everyone to have a new surgical mask every day. And that too evolved because recognizing that you would have personal contact as you handed off the mask. So we came up with some innovative ways to distribute those, ranging from everything from sort of a repurposed napkin dispenser to a board that we filled. We gowned up, filled it with masks, and everyone took one. And currently a popular method is to give people a week's worth of masks in a brown bag and allow them to, at the beginning of the week, and then they use them throughout. So that's a couple of examples of, some of the hurdles that we faced with the mask situation. Scott?
Yes, and to Carrie's point, getting these at first was very difficult. We have many operations in Europe, and we would ship our masks to our French locations, and the surgical masks were confiscated by the French government. They said, we need it in the hospitals worse than you do. So these are an example of challenges that we had. We've spent millions of dollars on PPE for our employees, but I think we can show that, again, we only have just a very few cases with inside the Stanley Black & Decker. So, and again, the majority come from outside. The N95s were particularly a challenge because, again, there were certain governors in certain states that said if you have these, you need to turn them over to our hospital staff, our hospital sector, so that our doctors and nurses can have them, because there were people inside the hospitals working that did not have clean masks. So we turned over all that we had to the different hospitals where we were located. But now today it's much better. We do have a mask out there, but you have to be careful, because during this time when we were tough to get, there were counterfeits out there, and you could a lot of people you could buy the mask and then they just took your money and ran, or they sent you something that was absolutely not an N95 or KN95 or a surgical mask. So we had to be careful and vet the suppliers to make sure that we weren't just giving our money away to people that were really not very scrupulous. Next.
All right. The next situation is sanitizers, gloves, surface cleaners, and really, again, we talked about availability, and I guess you could also add in price to that. So the cost of wipes and sanitizing wipes, for example, has gone up tremendously. Obviously that impacts the bottom line and our financial situation. What we ended up doing in GM when it started and really got here in March, the first message I got from my supervisor was, we're going to redeploy resources. We're closing down all the offices so that we can send all of our cleaning supplies, housekeeping staff, and PPE to the sites that are still going to function, the manufacturing sites and the warehouses, and that will free up resources that we don't currently have, because we can't get this stuff and it's not available. As you guys know, we then expanded. GM did start making their own hand sanitizer, which does come with its own drawbacks and challenges. Originally they thought about sending it to us in 55-gallon drums, which, as you can imagine, is a flammability nightmare. And so, figuring out not only what we would have to do to comply with the right FDA requirements, which were admittedly loosened up a little bit, but to comply with that, to be able to send it to us in a usable form and get it, was a challenge. And even to this day, we're more likely to have hand sanitizer than sanitizing wipes, and we're more likely to have disinfectant spray than sanitizing wipes. So we have actually reserved the sanitizing wipes for our housekeeping staff and facilities, and those of us that are doing additional cleaning in our areas are primarily using disinfectant spray. The challenge to that is then you have to teach everyone how to use it. And of course, each location across the world was able to get different kinds of spray, for example, with different sorts of sit times. So the one that I used in my facilities in the warehouse, the one that we could get in bulk for them, required a 10-minute sit time, which works in a warehouse because they can spray down their equipment and get their orders and get ready to pick. But that wouldn't work in a manufacturing site where 10 minutes is a long time. So we had to also figure out, okay, how do we get the 1-minute sit times to the manufacturing sites and keep these 10-minute sit times in the warehouses, and then also teach our employees how to use them correctly when they've never had to use them before. So, just figuring out all of that, as well as what additional folks are we going to need, to complete the housekeeping, was a challenge. So part of that was to close down areas that we didn't want to clean anymore. And of course, the fitness center was the first one to go. We're not going to clean equipment when we're trying to keep our offices and our manufacturing spaces clean. So we had to make decisions about that. What are we going to keep open? What are we going to be able to clean? How do we handle this? And then how do we teach everyone to do it the way they need to? Scott?
Yes, we'd like, the same thing. Couldn't get the wipes. We are just now able to get wipes, so we had to utilize the same sorts of ingenuity to get spray and paper towels, which have their own challenges for our field service people. So then they were out in the public, they could actually clean the area. Same thing, very difficult to get. Next slide.
All right, I think I spent the most time working on this one. Temperature screening, screening questions, and social distancing. So I think everyone has some form of this they're doing, whether it's using an app, physical screenings, asking questions. In our particular case, the goal was to have thermal scans at every location, but the type that was available varied, and it also comes with challenges in the fact that it's not taking a core temperature, it's taking the temperature of the outside world. So calibrating it for cold temperatures and hot temperatures and figuring out what happens when someone brings a hot drink in was important. And in fact, we had one guy measure at 119 degrees because his coffee was so hot. So figuring out the nuance of those thermal scanners, and then knowing that they're not a perfect screening. What do we do when someone pops high, and what is the line where we refer them to medical? Complicating that is that not all of our sites have medical available. So while our big manufacturing sites have plenty of doctors and nurses on site to help manage this, our smaller sites, most of our warehouses, our smaller labs, they don't have that available. So then we have to figure out what are we going to do with those folks to make sure that they not only get screened and get tested if needed, but that we manage, everything that comes with it. The other big challenge I'll mention is that the screening questions changed quite a bit over time. So if I think back to the January, February timeframe, we were asked to self-quarantine if we had traveled to 3 Asian countries. That slowly expanded and was completely based on travel. Once it really hit North America, the questions were basically, have you been exposed, or are you feeling the symptoms, number one? And those symptoms changed over time. Then have you traveled, and have you been exposed by a family member? So that has changed significantly and actually varies down to the county level in some cases. So while my counterparts in Southeast Michigan are asking about the symptoms and the travel, and any exposures, we actually had to add over here on the other side of the state, we had to add additional symptoms and rephrase the question. So, just getting that nuance around the screening was important. But that doesn't even touch the idea of how you get people in the door, 6 feet apart, take their temperature, hand them a mask, give them the screening question, and get them on their merry way in a reasonable time frame. So our warehouses are trying to get approximately 100 people, 150 through the door at every shift. But our manufacturing sites might be getting 1,200 people through the door on any given shift. So, all of that creates a lot of time and effort into just getting people through the door and hopefully screening out anyone that may be sick or may have been exposed to someone that could bring it in. Scott?
Yeah. And same thing, I just would tell anybody, make sure when you come up with these questions, follow CDC guidelines, get your HR folks involved, your EH&S folks involved, your operations folks involved, and as a team figure out, one, the questions that you can ask through CDC guidelines, but also logistically, as Carrie's mentioned, how you get people through the door. In some plants that we have 5,000 employees at one facility. So how do you do that? So we had multiple entry points, things like this. So get a team involved, and it really will help you. Next slide.
All right. Inevitably, you're going to have a case in the workplace. I'm going to say it that way because something's going to show up. In the location I'm sitting in today, we've had 2. Both were outside exposures, but there are challenges that go with that. And in the beginning, the challenge was that there was no way we could get these employees tested. Now GM is lucky enough that we do have tests on site if we have medical, and we have contracts in place so that we can test our employees if we don't have medical available. So originally the challenge was the tests and getting a hold of them and getting the results back. But the other side of it is once you know that someone's positive, it really relies on human integrity and human nature to figure out where they've been and what they've been doing. You might know generally what they do in a day based on their job description, but you can't necessarily know who they hung out with in break, who they ate lunch with, whether they took a smoke break or not. Things like that impact the contact tracing. And to give you some perspective there, my husband works at Michigan State University. They rely on the Department of Health to do their contact tracing for them. Here in GM, we are not doing that. We are relying on our HR group along with medical to work together to try to do as much contact tracing as we can. And then we make the decision based on CDC guidelines about who needs to quarantine and who doesn't. And then, of course, we have had people that have come up after the fact and said, hey, I'm not comfortable. I felt I was too close to this person or that person. I want to alert you to that fact. The hard part about this, too, is that with the HIPAA requirements, you can't give out names. So there's some definite frustration on the point of the employees about not being able to know exactly who went out at what time and when and why. What we're able to tell them is we have or are either completing or have completed contact tracing, and we're trying to contact the people that could be affected. But you can't necessarily tell them it was this person in this department, that you should be aware of. So there are some challenges to managing the actual positive cases, and the ensuing communication after the fact. No matter how hard you try, and I'm going to go out on a limb here, Scott, you can back me up if you want to, but no matter how hard you try, no matter how fast you get the communication out, it's not going to be fast enough. So to get a communication out that says we've had a positive case, we've done the contact tracing, we've disinfected the site, even if you were able to do that immediately, it wouldn't be fast enough. The rumor mill flies super fast, and that's another challenge you have to deal with. Scott?
Yeah, I would echo that. These situations run through a facility like wildfire. But again, just make sure that you have a plan for that and how you're going to communicate that. And then also one of the other points is make sure we request testing when you return to work, that you have to have 2 negative tests. Again, follow CDC guidelines. Not always do they actually do that, but we don't. Doctors won't always do that, but that's what we request. So sometimes it's just a return to work from a doctor. Next slide.
All right, we both agreed on this one that training was taking place in all sorts of forms and different ways. In our case, just getting people to understand what was going to be expected as they walked through the door. We did that through a variety of ways. We tried to use our employee communication structure. Unfortunately, some of our hourly folks have chosen not to sign up for that. It's not required for them by contract. So we couldn't just send out an alert like we might if we had weather issues or some sort of issue on a campus. We also did work with our unions to get on their Facebook pages and to send information out. A letter went out from our CEO with some PPE to get everyone started. And probably the most successful thing we did, at least in the beginning, was that as we opened up every facility, we put everybody, top to bottom, through an orientation. Sometimes that orientation was done using an online class and what we called the playbook. But me personally, I did 7 classes where I did in person. Here's what we're doing. Here's why we're doing it. Here's what you can expect, and walking everybody through. But again, it could happen through an app or other things. And the same is true of once a case is identified, is making sure that employees know how to return to work and what's expected we follow Scott's comment, 2 negative tests and no symptoms. Knowing what they need to do when they come back to work, knowing what we need to communicate out when there is a case, and how we keep people informed and answer their questions about all the stuff that's going on. So, the number one question is always, how long do we have to wear these masks? And how long do you think this is going to go on? So answering those types of questions and having a really strong process to share lessons learned, frequently asked questions, feedback on why we do what we do was important. Scott?
Yep, I just would say we're running short on time here. Just like I think it was going to be summed up, you cannot over-communicate. We're fortunate enough at Stanley Black & Decker to have Workplace, which is similar to Facebook work, and we were able to communicate with that, which is a great tool, but you cannot over-communicate to people. Next slide. I think that might be it. There, that's it.
Good work. Thank you.
Okay. Yeah, thank you. Steve Axel, you're up.
Great. Thanks, Andy. And thanks, Carrie and Scott. I'd like to say that I think Carrie and Scott have given everyone an excellent insight on practical challenges and creative solutions for managing manufacturing environments in the face of COVID risks. I'm going to focus for a few minutes on the OSHA compliance and enforcement angle. Much like other federal agencies that have had to intersect with COVID-19 issues, OSHA took action fairly quickly in response to the emerging pandemic. The agency's been faced with an array of tasks and priorities in the immediate wake of the onset of the pandemic. Some of these are ordinary to their mission. Some of these are fairly unique. I think all of them were clearly on timelines that they rarely have to deal with. This first slide summarizes an array of sort of some of the key COVID-related OSHA activities. I'll use this as a jumping off point to get into a bit more detail later on some of these initiatives. Regarding the first bullet there on PPE, OSHA, as everyone, was faced with this reality that PPE was in very short supply and needed in ways and for purposes that were ordinarily not being used. And as we all know, PPE was being prioritized for hospital and healthcare workers. OSHA had to quickly react to that and show some flexibility on some of the PPE requirements that are baked into the OSHA standards due to just, practical realities. They had to allow some discretion on PPE substitution. Certain types of PPE were, for a time at least, just simply not available. Some sorts of testing, there are all sorts of requirements in the OSHA rules relating to respiratory protection programs, and some of these rely on outside contractors who do certain sorts of medical testing, fit testing, other things where you have to send an employee outside to sort of a medical environment. But many of those things were simply not available, and OSHA had to show some flexibility on those things and came out with sort of rapid fire guidance on certain related issues to PPE. The repurposing of existing regulatory authorities, we'll talk about that on the next slide, but they had to figure out how they were going to enforce in a new world with in the face of COVID. Regarding enforcement, there were various guidance documents issued. We're going to talk about those in a little bit more detail later on. As to outreach, they recently put out a detailed guidance, but also have been doing other outreach efforts to outline, probably more aimed at less sophisticated companies than multinationals like Scott and Carrie's companies, but for folks who may not have as much depth in their environmental health and safety groups, some guidance on how should we think about reopening, what steps should we take protect our employees. And then enforcement. We're going to talk a little bit later about enforcement, a variety of developments there. Next slide, please. We're going to talk a little bit about what is OSHA using in the enforcement world. What are they using to protect employees in this new world that we're in? There are no new federal emergency rules that relate specifically to COVID issues. However, this was attempted. There was some back and forth in Congress trying to push for that. It has not happened. But there are a variety of pre-existing OSHA regulatory requirements that the agency can use to protect employees from COVID risks. And all employers should have these on their radar as they move forward. These will be standards you're probably already complying with, but now also in an expanded fashion and in a new context. First, in the PPE area, there will be, and there already are, an expanded use of things like respirators, gloves. It not only expands usage, but expands the number of employees, the categories, job titles that might be using certain types of PPE and the situations where they're using. And so employers need to be thinking about, how do I comply with the existing PPE rules in this new situation where I have more and different folks using different types of PPE? There are assessment requirements where you determine what PPE is needed for a certain job, and that may be different now than it was 4 or 5 months ago. There's training, there's fit testing, there's sometimes medical testing that needs to be done, et cetera. On the record keeping and reporting front, there's been a lot of activity here. We're going to cover that in a little more detail on the next slide. In the hazard communication area, hazard communication standards generally require training, program development, maintenance of safety data sheets, et cetera, to protect employees from the risks of exposure to hazardous chemicals. That's something that employers need to deal with generally. And these rules also require real-time updating of programs. So think about this and consider this. As things change rapidly in this post-COVID environment, as you add new cleansers, sanitizers, disinfectants to your arsenal of chemical products that you use at your plant, think about being sure to update on a real-time basis your HAZCOM compliance programs as these changes occur. The general duty clause. This is OSHA's catch-all enforcement tool for situations where they don't have a specific standard already promulgated. It's a statutory authority rather than a rule, and it's designed for the type of situation that we're in here. It can be used to enforce failures to address, quote, any recognized hazard. So is a hazard recognized? Think about this for a second. Something that wasn't really a recognized hazard in February of this year may truly be a recognized hazard as of today. So they may be trying to use that eventually. Finally, state-specific standards. As many of you are probably aware, many states have the authority to run their own OSHA programs. Most who have their own programs adopt OSHA's standards wholesale and by reference. A few have their own unique, more specific, and usually more demanding standards. Just this week, Virginia approved a temporary emergency rule requiring coronavirus protection plans to be put in place. Now, a more sophisticated company like Scott and Carey's probably already has the equivalent of this in place because of the proactive things they've already done. But beware, these things are emerging. This rule, which goes into effect I believe next week, requires this to be done within 30 days. And reportedly, Oregon is working on a similar rule, and I would expect more of the same. Next slide, please. Let's talk for a minute about recording and recording duties. OSHA rules require employers to record work-related injuries and illnesses. Here's the problem being faced by facilities today. Is the employee COVID positive that I just discovered work-related and needing to be recorded or not? And, really, how do you know? OSHA issued a guidance back in April because this was a very immediate problem where employers were throwing up their hands. And OSHA quickly recognized in that first guidance in April that this would be a big problem and quickly issued this document, which provided a lot of flexibility. Essentially, cutting to the chase, it recognized the difficulties in determining whether a given COVID positive would be work-related or not. They gave a lot of flexibility to employers other than healthcare, emergency response, and prisons. For all the rest of the industries, essentially, you weren't required to make a work-relatedness analysis unless there was some objective, clear evidence of workplace connection. Now, this is how quickly things change. In May, they rescinded that guidance and issued another, expanding, I believe, thinking that things were getting back to normal, which seemed to be perhaps the case at the middle of May. And now, under the revised guidance, all industries are expected to perform work-relatedness analyses to figure out whether they should be recording a given illness. However, they do recognize and allow that an employer only need use available evidence. You don't need to essentially do an elaborate investigation on your own. Of course, if you have multiple positives in your plant in proximity to this new one that you're evaluating, you can probably very quickly make a determination that it may very well be reportable. Next slide, please. Let's talk a little bit about enforcement. OSHA has issued a couple of documents guidance to their area offices about how to prioritize enforcement, and they've prioritized COVID-related enforcement, although they're very cautious about whether they're able to actually go out in person to facilities. They've made it clear that they're prioritizing COVID-related enforcement issues. At the same time, they recognize that there are some real challenges for employers out there, and they've issued a guidance that provides essentially some enforcement discretion and leniency back in April. However, I would proceed with caution in trying to utilize this. The guidance offers conditional enforcement discretion in certain situations. There's limitations on scope. The areas where compliance is truly hampered by the pandemic. For example, PPE, medical testing, services that you need to get to be in compliance that were or are simply not available. And of course, this list of what is truly hampered by the pandemic will change over time. Something that was understandable in March may not be in July or August. The guidance also requires good faith efforts to comply. And I would suggest for anyone who might need to try and take advantage of this to very well document your efforts. You would need to make the good faith efforts. You would need to come up with the best available alternative plan and implement it. And then you would also be well advised to have a plan to return to compliance and document that. Next slide, please. More generally, the reality where boots hit the ground on enforcement, One of the things that's happening the most are employee complaint investigations. The employee complaint investigation is an OSHA enforcement activity that has become increasingly common for a decade since the financial crisis. And I think this is probably a good thing for OSHA. They became very adept because of resource limitations at doing these investigations virtually by letter, by email, by phone years ago. And that's probably paying dividends for them and frankly, for employers as well. Now, I'm seeing a lot of these among my manufacturing clients. Often, these employee complaints, this is not just COVID times, but prior, they're not well-founded sometimes. They're not, it appears quickly that maybe they're not based in reality or accurate, as employees are often disgruntled or not well informed about the employer's actual OSHA duties. However annoying these are, when they come in by email or letter rather than in person, and during these times it's pretty much all being done, they're all being done virtually. I would suggest view it as an opportunity to avoid an in-person inspection and put your best efforts into a robust, thorough response, as doing so gets you the benefit of having OSHA close the investigation without coming into your facility. In-person inspections are down. COVID-related enforcement activity is prioritized, but I'd say it's pretty rare that they're coming into facilities, particularly in the first few months. I think they're beginning to do in-person inspections a little bit more, very carefully. They're working their way through protocols for doing so, but not back up to, certainly not back to the level of pre-COVID in-person inspections. COVID enforcement cases have been rare. A few have just started to hit on issues such as failures to record, failures to report, hospitalizations that are work-related, et cetera. I would expect that these will increase, and that leniency that was available will probably narrow over time. Next slide, please. Some practical tips. I would say most employers are probably establishing new COVID-19 work rules to deal with social distancing, PPE, et cetera. Good advice, I think, is to treat these new work rules like regulatory mandates. They may become such eventually anyway. There are other reasons, including the opportunity to possibly establish an OSHA affirmative defense. So I'm suggesting here document, train, enforce, and discipline like any work rule. One reason is being able to establish the unpreventable employee misconduct defense, whether they use the general duty clause or some other actual standard that exists now or may come into place. To use that defense, you must actually set a work rule, then train the relevant folks to that work rule, enforce the rule, and then show a record of progressive discipline. Pretty hard usually to establish all of those, but a very useful defense if you can manage it. Thanks. I'll turn it over to Ted.
Thanks. Next slide, Andy. Thanks. So I wanted to talk a little bit about virtual auditing and maybe some of the reasons that folks are now bringing up the concept. We've lost a little bit of regulatory focus for a lot of the reasons already brought up today. Reduced employment, essential employees only are in the plant. We've got employees who have new responsibilities or modified responsibilities and might take their eye off the compliance ball that they had otherwise. Reduced employee interaction, or today's word, collaboration, all create these issues where perhaps some compliance issues have been less attended to. And so, EPA recognized that by issuing their temporary policy about enforcement discretion to give a little relief for routine monitoring and reporting. Just like Scott discussed in the OSHA context, these federal requirements can gain some relief if, again, like Scott said, you act responsibly, you document these items, what's the nature, the date of each one of them, you take the time to identify why COVID-19 actually helped to cause that issue not to be tracked. So, for example, you've got monitors in place and need people to be there and they aren't there. And then what efforts you're making to fix those and how you can fix those as quickly as possible. So that policy is important, and it goes through August 31st at this point to give some relief, and yet it only applies to federal concerns. So we also have states out there. I took a quick look, and it looks like Ohio, Kentucky, Indiana, and Michigan, our neighbors, all have similar policies, slight different twists here and there, but essentially the same kind of concept. So if you take all these things together with our limited employment at the facilities, and especially some in management where a person might have multiple sites that they have to manage, we can have less focus on our regulatory programs. Next slide, Andy. And so that affects the whole concept of why do we audit, and of course you recognize in this list all the traditional concepts of why companies audit, but some of the newer ones because of COVID down there at the fifth bullet, the transition to new employees. We've had a lot of hiring, interestingly, through this period where new employees are placed in positions in plants where they're not familiar with the plant, or they have a modified position because of COVID and might be sent to a plant they're not familiar with, even though they're still with the same company. And so these concepts of auditing can be extended beyond just your traditional audit concept and be used to help place a new person or modified position in the know with what they have to do by giving a little bit of assessment for their particular activities and the help that they need to get off on the right foot. And then the last bullet, just auditing in this particular period, it helps us to maintain that adequate and good, strong oversight to our regulatory focus when we're stretched thin and may otherwise want to step away from that and do the other portions of our job responsibilities. Next slide. So how do we regain focus by doing some audits in a period when visitors might be limited to a plant? And so these are the three types of audits. We're all familiar with the traditional one where a person or a team goes to a plant and performs an audit at the plant, and surprisingly we're doing some of that now. Some companies have taken a little different approach than Carrie and Scott mentioned today, where they're allowing visitors in to do this kind of thing, and other companies have gone completely remote and might be that way for the entire year. So we've developed some remote auditing techniques to help those companies, and in that case, everything is done from our office. And that requires a lot more site cooperation and some commitments that we'll talk about a little bit later. And then we have another approach, which I refer to as a hybrid audit. And in that case, what we're trying to do is effectively do 90% of the audit remotely, but if the plant can allow one person in for one day, that person can represent the team and kind of wrap up some of those loose ends and critical items that are difficult to do from a remote standpoint. So let's go to the next slide and start talking about how do we actually perform one of these. And so the first step, just like any traditional audit, is to get out some pre-audit questionnaires to find out what the plant does, what kind of activities they're subject to, and to add a new one about how to do a remote audit. So there's a questionnaire we've developed that tries to identify some of the things we're going to need to know to do a remote audit. What platforms will the plant allow, or what are they familiar with? ShareFile, SharePoint, Teams. All of them have their favorites, and there might be one or two to choose from for video or for document, or to do both at the same time. We need to identify, of course, the site's goals and the limitations. It's difficult to do live video if there's no wireless or phone signal somewhere in the plant. So we need to understand where those signals are. That's part of the pre-audit questionnaire's purpose. And do we want to do a full audit or scope the audit down to particular activities? For example, like I mentioned, transitioning a new employee or somebody with modified skills or modified responsibilities. And then we need to understand what video approach we're going to use. And I like to keep it simple, silly there. I won't call it stupid, I'll call it silly, because we want to make this as simple as we possibly can for those involved, because we want them focused on the things going on around them so that they're safe and they don't have to be thinking about several other things that they're not familiar with. So I like to, if possible, use a mobile phone and then consider, do we want to do it as a live video, a recorded video, still photography, or a mixture of all of these for multiple reasons that we'll talk about. And we can't forget the audio piece of this. Noise can really play a lot of havoc, and so we'll talk about that a little bit. But the pre-audit questionnaire is designed to help us understand where is it noisy, where is it not. And then we need to plan the tour route. So this takes quite a bit more time than the traditional audit. It's an important piece to getting through the plant in a good, solid, and logical manner. And finally, we need to work with the plant to pick the right tour guide, and we'll talk a little bit about that in a minute. So let's go to the next slide, and we'll talk about the two pieces of an audit. The first one here, the document review, and in a remote audit, we break that into three phases. The pre-audit document request will ask for a number of documents, just like in a traditional audit, and we get those documents so we can look at those ahead of time, mostly plans, permits, maybe a few reports here or there to understand how the plant operates, what they do, and be able to go to the plant well prepared. Well, in this case, rather than going to the plant, we then follow up that document request by asking for many of these other documents that we would traditionally look at on site: inspection records, training, monitoring records, confined space permits, hot work permits, etc. This over in the pro and con box, that creates a situation where, yeah, there's no travel, so the expenses are way down, but some of the disadvantages of that are that we have increased plant effort required. Like uploading documents doesn't sound that tough, but when you get into the many documents in an EH&S audit, some of which are paper records or inspections or letters, it's going to require some scanning and uploading, and then documents that are different sizes can create a challenge, like drawings, for example, if we need those, maps and spill control plans, that kind of thing. So it takes a commitment on the part of the plant to deal with this, and we can talk about, scoping the audit. Do we drop down on some of do we look at 3 years of records, or do we drop that down to maybe 1 year? What kind of sample size do we need to make this make sense? And then finally, we can look at these documents offline, which frees up the plant personnel to do other things and is a great advantage to them. The disadvantage is we can't ask questions while we're doing that, and we'll have to table those and put those together for a later scheduled event. We can look at the documents live, which is really pretty good for simple documents. Or, for example, we want to look at some training programs or training records, cross a few T's and dot a few I's here and there. That works pretty well if the plant has a very well organized record-keeping program, and the documents are easily available and can be put up on the screen just like you would in a conference room on the projector screen. That also allows you to address the questions right away. You can have good discussions about those documents and pretty much wrap up that piece of review right at that time. But a disadvantage of that is you need the person who either owns the program or knows the most about it to be present, and that might cause them to have to sit there and waste a little bit of their time. But again, it is live and pretty efficient. It's not a good way to deal with complex documents like permits that have many terms and conditions. Those really need to be dealt with probably offline and then in some separate questions. Finally, the last phase of that document request would be just like in a traditional audit. After you walk through the plant, you see a few things, you end up having a number of other documents you need to see to wrap things up. It's not a lot of them, but I would call that the cleanup document request, and that's going to happen after we do the remote tour that we're going to talk about next. So next slide, Andy. So in performing the remote tour, this is definitely the most challenging piece of a remote audit. And the tour guide that you have in place has to have some key attributes. They have to really know the facility. They have to know EH&S pretty well, because you're going to trust them to get you from one point to another and to have some discussions as they go. So one challenge could be if the plant has environmental people and safety people, as opposed to people who do combined programs, you might have to split that up into two separate walkthroughs, or possibly do some things with multiple personnel. They have to be committed to the process, because it does take some time and effort and focus, and that will be worked out through the plan view and the tour concept. They have to be able to communicate well, but then I put down their patience is one of the big virtues in these audits, because it just takes a lot of being very patient, keeping an eye on the ball, and understanding what we're all getting into as we go. And then we manage the pace through the audit so that we still get a good quality review as we walk through. So what are the pros and cons of this? Well, again, we don't have travel expenses, so that's good. And if we keep things simple, any expenses can be fairly limited. But one of the disadvantages is we're now asking a person to walk through the facility with a phone or a camera, which in some facilities is not permitted in the first place. So we need to work those things out to make sure we handle that well and keep the person walking with that camera safe. The schedule's flexible. That's a good advantage of doing a remote audit. You can start and stop whenever you want to, but it can become a disadvantage because it's easy for people then to be interrupted with meetings and phone calls. So that's the commitment we have to the process, to make sure that we still get through it in a stated time frame or close to it. And then when we get back to our keeping it simple program and try to use a mobile phone, why is that a good advantage? Well, of course, everybody has one. They're familiar with it. You don't have to mount it on anything. You can carry it in your hand. You don't need an app to be able to work with it. So there's nothing new to learn there. So what else can you do with it? Well, you could snap pictures when you want to. You can zoom in on things like labels or a posting, and you can look at that label later if you want to. But some of the disadvantages and things that you just have to be work with are that, again, it's signal dependent. You have to make sure that you've got that signal, or you have to do some recording. It does have a limited field of view. We found that it doesn't give you a wide periphery, which is important in auditing, but you can attach a clip-on wide-angle lens for about $20 and at least improve that to some extent. And another way to deal with that is to have the person, as they step into each department, stop and do a scan of the department 2 or 3 different times, following some words that you might put together that are of interest to you, so that they actually see things and stop as they go. So for example, if you want to make sure you have exit signs and exit routes in good shape and aisleways, or if you want to say scan the room for confined spaces or a lockout project, or for waste management issues, that will help you keep the pace slow enough to be able to see some of those things and then zoom in on those once you start to walk again. And if the picture is bouncy, or don't want to get seasick, you can add a stabilizer for about $50, and it might actually be easier and more comfortable for the guide to walk with. And then, as I mentioned, the noisy areas, you will want to do something like add a Bluetooth headset to that, probably one ear, so again, you maintain some safety with that person, but for $75, you could add a decent Bluetooth and still be able to communicate. If you don't do that, you got 2 heads that go different directions, because one is following the walking path you talked about, and the other is looking through a screen trying to get him to stop. So it's kind of a little challenge there with a couple people trying to do the same thing. And then another one that was new to us was when you take live video, the battery life of a phone only goes about 3 hours. So you need to work in some planned breaks or maybe some other phones. And we also found that taking notes can be difficult, again, because you got 2 heads working there. one of them's walking and not really realizing you're taking notes, and so you can take your eyes off the picture there, and you might need to have a second person there or make sure that you've got good communications to deal with that. And then finally, the last slide, Andy, are there other concerns? There's going to always be other concerns, and some of those I just throw out that we will have to deal with in certain locations. Our proprietary processes and equipment that facilities don't like photos taken of, and so there are we able to deal with those through agreements like the attorney-client privilege, or maybe a non-disclosure agreement, or perhaps we can have a destruction agreement where everything will be destroyed within a couple weeks, or do we just agree to cut things out of the scope and not to record at all? So those are some options there. Then some plants are going to have classified areas where we've got flammability issues. You can encase a phone for about $750, or do you just avoid that room, or do you treat it like a confined space and get it ventilated before you go in? Can you look through windows or doorways, which aren't always the best option, but those are some things we will have to deal with. Maybe there's a security camera there that you could hijack from the security room and see what's going on from that vantage point. And finally, there are some activities that have PPE requirements that can interfere. If you have to wear a respirator or gloves or maybe a face shield, that's going to create some issues. So you could look at what time should we go to that room? Should it be operating or not? And can we avoid some of those issues? Or could we mount the phone at that point on a shirt or something to take their hands away from having too many things to think about? Are there other viewing locations like a mezzanine, or can you use a telephoto lens for some things? And can you use another person to help spot and keep an eye on your safety? And then finally, I just always go back to, if you have issues like this and you can't do a thorough job remotely for at least some particular areas, well, maybe you can go hybrid just to go look at those areas and have one person who knows EH&S in all areas go in for one day, deal with those areas, COVID protected, and get out of sight as quick as possible, but then be able to wrap things up. So thanks. That's all I have for now.
Thank you, Ted. So we'll turn now to a discussion of state and federal environmental enforcement before, during, and after the pandemic. Now, you may think that enforcement of environmental laws varies dramatically depending on who's in the White House, Republican or Democrat. But we see that the effects are moderated by a lot of factors, primarily the significant role played by state agencies and their budget constraints, and then there's a lot of other factors. In any event, we have seen some enforcement trends that have been evolving for a long time, regardless of who's in the White House. One factor driving these trends has been a consistent decrease in EPA funding over the years, and you see similar trends with state agencies generally. With less money, they have been conducting less inspections, as you'll see that in the coming slides. This has led EPA to try to gain more bang for the buck by focusing on larger cases that result in larger fines, criminal convictions, and imprisonment, sometimes of CEOs or other high officials that receive a lot of press coverage and in turn sends a strong message to companies to comply. I have a couple slides to illustrate the decreasing enforcement statistics at US EPA. First, the EPA Inspector General issued a report in March which quantified some of these changes over time. This slide shows, among other things, the decreases from 2007 to 2018, where inspections are down 33%, enforcement cases are down 52%. This slide shows that the trend started long before the Trump presidency, although you can see that the number of inspections has decreased significantly during his administration. Now, I wanted to mention next generation compliance. This was announced in 2014 by EPA's Office of Enforcement and Compliance Assurance, OECA, during the Obama administration. It's not officially withdrawn by the current EPA, but they have noted that essentially it was in effect only from 2014 to 2017. But I'm mentioning it because it clearly is the wave of the future for U.S. EPA and state agencies facing shrinking budgets, the widely acceptance of electronic reporting, new technologies, and now this pandemic. In summary, it calls for the use of advanced emissions pollutant detection technologies to more easily identify noncompliance. For example, infrared cameras to find emission leaks. It includes increased electronic reporting that helps EPA monitor compliance. It makes information more acceptable or accessible to the public, and it uses innovative enforcement approaches such as data analytics and targeting. These tools are in place and will continue to play a bigger role in the future. I threw this graph in to show the dramatic increase in the use of EPA's voluntary self-policing policy over the years. As most of you know, it provides penalty immunity for violations discovered during a voluntary audit or through your environmental management program. This is another tool used by EPA and states to encourage companies to comply. It's a tool that our clients have used quite effectively to improve compliance while avoiding or reducing penalties. Now, turning to the pandemic, President Trump issued an executive order on May 19th stating that agencies must exercise enforcement discretion when companies have made good faith attempts to comply. The jury is still out generally on how federal agencies will apply this executive order, but we know that EPA was ahead of the president when it issued its COVID-19 enforcement policy that Ted mentioned in his presentation. So what's going on in the real world? We know that many agency employees are still working from home, so we're seeing less inspectors in the field. We are seeing increasing efforts by EPA and state agencies to do their jobs remotely with increased information requests, phone and video interviews, and even remote inspections where the inspector has asked the facility folks to walk the inspector around the facility using FaceTime or Zoom. We've been involved in one case where the state agency initiated the inspection via email, asked the facility to provide photographs of certain areas and operations, and then later physically inspected the facility. We know that U.S. EPA is using drones and planning to use them more extensively, perhaps similar to how OSHA has used drones to inspect large sites, construction sites, and other large complexes. Several years ago, it was reported that Region 4 was using a drone equipped with an infrared camera to detect radiation sources at plants. We were aware that EPA Region 2 reported its use of a drone to assess a partially collapsed roof that had asbestos concerns, and they noted that the use could be extended to spill sites and many other applications, and we're providing training to staff, drone training to staff. We know that EPA is using drones to monitor engineering and institutional controls at Superfund sites. And I'll mention that years ago, I remember this maybe 8 to 10 years ago, EPA was sort of called to the carpet by farmers because they were using manned planes to fly over farmlands looking for contaminated runoff and other illegal acts. And it raised a lot of concerns, and Congress got involved and so forth. But you know, certainly, you know, the use of a drone is not far from a manned plane. Certainly, the use of drones expands what is visible in plain view. There are some constitutional issues regarding unreasonable searches and certainly how to manage these inspections. The topic goes beyond the scope of today's webinar, but certainly something that we're going to keep our eyes on. But this is the new normal, and we anticipate these practices and technologies to stay long after COVID-19 is gone. So this is the EPA policy. I'm going to skip over this in the interest of time, noting only that there are certain non-compliance that you simply need to document internally and provide it to EPA upon request, and other things that require reporting. And this slide that you'll have in your deck elaborates on that. All right, and in a post-pandemic world, we expect the increased use of these new technologies, more and more use of information requests. We've seen that already. Video interviews and inspections and the other next-gen tools that I mentioned earlier. There's a backlog of inspections, so we do expect EPA to try to play catch-up. You know, earlier I would have said the summer. Now I'm saying perhaps catching up this fall, but it may even be later, depending on when it's safe for them to travel. And they're going to be required to prioritize based on potential seriousness of the violations, the risk of harm, and other factors. We expect citizen suits to continue to increase as a direct result of the continuing trend of decreased EPA and state enforcement, and perhaps based on the discovery of COVID-19 related noncompliance, as that information becomes public through FOIA requests and otherwise. And let's not forget about environmental justice in this new era. That emerged years ago as a major issue, and there was an executive order in 1994 saying that agencies had to develop policies to achieve environmental justice. EPA for years has made an issue of importance in its programs, and we would expect more focus on disparate impacts in terms of NEPA, rulemaking, permitting, and enforcement. And in any event, you know, in this climate, I think the regulated community needs to put greater consideration on the implications of discharges, accidental releases, and so forth that may harm environmental justice communities, and as well as their asset siting to avoid government scrutiny and bad publicity if there's harm. The significant caveat to all of this is that things will change if Biden is elected in November. If that happens, get ready for a lot of webinar invitations on what to expect from a Biden administration. Now, achieving compliance in this new world, I think, involves many of the same tools and strategies that have proven effective in the past. I'm going to, in the interest of time, I'm going to skip over this. And, you know, I think I'm in the interest of time and making sure that Rajiv has a little bit more time, I'll skip over this as well, but it's in your slide deck. And I think also Scott and Carrie covered a lot of the contingency planning issues. So with that, I'm going to send it over to Rajiv.
Thank you, Andy. So I'm going to talk a little bit about how COVID-19 has impacted site investigation remediation projects for our clients, as well as suggestions for planning and designing installation of future remedial systems. Andy, next slide, please. So with a little bit of planning, for site investigations, it can be fairly simple to maintain distancing at site investigations. Most of those are generally outdoors. They're scattered out over big areas. And in fact, several of our site investigations have proceeded exactly as planned during this time. We've completed monitoring network well installations, ground penetrating radar surveys, etc. Remediation projects that have been on abandoned properties or on in remote locations, they've been also proceeded as planned. But as the pandemic unfolded in March, operating facilities, they started to restrict non-essential personnel from coming on site, and that was true of both commercial facilities and government installations. And there's no one-size-fits-all. There are many types of remediation projects, and the risks of not operating a remediation system was a good way to decide if routine O&M and routine operations should continue or should be postponed in response to COVID-19. We looked at two different, very broadly characterized systems into two different categories. You have systems that have remedial action goals. They were installed in there to meet a future remedial action goal, and there was not an immediate threat to human health or the environment. Examples of such systems are where you have soil excavation treatment, you have multi-phase vapor extraction systems where you're trying to get to a end goal of meeting drinking water regulations at some point in the future, 15, 20 years down the road. But then you also have critical systems, these systems that are serving as a barrier system. They're trying to keep contamination from reaching a sensitive receptor, and those are the ones that felt that you should consider running. Next slide, please. So the ones that have remedial action goal systems, we can postpone the activities where possible. Excavation projects, tank removal replacements. Andy and Ted both mentioned about EPA's temporary policy regarding enforcement discretion that sunsets on August 31st. But in many cases, discussions with regulatory agencies yielded good results in how certain monitoring events and how certain remediation projects can be postponed. Next slide, please. So, but when it came to barrier systems, there were ones that it was critical to keep those operating. There were systems that were intended to keep vapor migrating, for instance, out of actively occupied buildings. So there were systems that were designed to hold plumes back from going towards a drinking water field or discharging into wetlands. And for those systems to keep up and running, a lot of the points that Scott and Carrie made about personnel operating was also critical here. But what we found in some of these cases, pre-planning was critical in identified primary operators and backup operators, so that you knew who was going to be on site and who could replace them as coming off the bench, so to speak. Cross-trained personnel, so others can fill in if anyone has to quarantine. Prepare comprehensive manuals, make it easy to train new and temporary staff, or in some cases, even personnel on facilities where these systems may be located. Start stockpiling supplies, hand sanitizers, wipes, masks, etc., that can be stored in equipment trailers along with groundwater bailing equipment and everything else, so that you have a ready source of material to draw on as the case might be. What we also found was that there were some sites that had protocols in place where they had been placed in there in anticipation of personnel strikes at facilities, and those plans actually turned out to be fairly useful in crafting plans for how to deal with COVID-19 related restrictions that are coming on site, because they posed the same kind of site access issues and personnel access issues that COVID-19 did, and then implement enhanced personnel and contractor safety. What did that mean? Next slide, please. So this was not much different than what Kerry and Scott talked about, really, about facility safety. In fact, first thing we did was look to a facility for guidance on how we should instruct our personnel to conduct business on their facilities, and make sure that folks like Scott and Kerry and the guidelines that they laid out for their facility personnel protection, we followed those to stay in step with the facility requirements. But some of the broad items in there was encourage hand washing, use sanitizer, provide masks. One interesting point in there was there were facilities where we had to have masks made of FRC, flame resistant clothing, because it was mandatory at those facilities. We added COVID-19 to tailgate safety meetings, did safety observations, and included how we were distancing into our routine health and safety observations. Found that masks can actually add to fatigue on project sites where you have hot weather as an issue, or where you could have, similar to what we would do if you were wearing full face respirators or even half face respirators, and increase the breaks to keep that fatigue down. If possible, avoid sharing tools, dedicated tools for each employee, so that you don't have to keep disinfecting the tools. Where each employee keeps their own set of tools. And if it wasn't possible, radios, 4-gas meters, things like that, have the means to be able to safely disinfect those without harming the equipment, so that you don't use things that can leak through rubber or whatever the protective casing happens to be on that equipment. And travel slowly in vehicles if possible. If not possible, then have small groups dedicated to fleet vehicles, so that and make sure it's disinfected, so that who's using what vehicle. Next slide, please. So how do we plan for the new normal coming through? A lot of the same items that Scott, Kerry, and other presenters brought in: temperature screens, screening questions, follow the facility health and safety plans, update the health and safety plans and monitoring plans and operations plans to allow for fewer personnel, and if possible, reduced monitoring. We've been looking at using handheld devices like iPads and Microsoft Surface and Android devices and Apple devices and other devices with pre-loaded forms for field inspection and taking notes. And if need be, you can buy these things. I think Ted mentioned that you can buy these things with explosion-proof cases, or they can be inherently or intrinsically safe if you get the right type of equipment. And if you have this out in the field, this will eliminate the need to use paper, and you won't have to have notebooks that are passed on from field personnel to office personnel for transcription. And a big side benefit of this, as it turns out, is that it's quicker transcription and fewer errors, so that it's something that perhaps should have been adapted much earlier, but COVID-19's pushing us into this technology adaptation. We found using conference call systems that do not require a moderator to start was a great idea. Teams is a good one for that. It's one way to quickly have online meetings, and to have a bunch of people gather together quickly to troubleshoot a situation, would leverage new technology. Necessity is a great teaching motivator. I mean, the situation has forced all of us to quickly overcome this reluctance of adopting new technology. And so some of the new technology tools to consider down the future, on the next slide, please. Use video and audio to monitor systems. Pan-tilt zoom cameras, which are fairly ubiquitous in the world right now, they've come down significantly in price, and they're easy to install, and they can broadcast remotely. Security cameras are cheap and in a good option. In fact, even a Ring doorbell camera is a great option to just quickly be up and running and have some eyes on remediation systems and other systems. One point to consider here is to come in and add infrared video. Infrared cameras have also significantly come down in price. They're really cheap now. And if you add infrared video, it allows valuable information to be relayed back, such as, is my pump overheating? Is the blower operating improperly? Is it just making a lot of noise and not actually working? Is heating tape malfunctioning, for example? And if that's the case, then down the road the lines can freeze up that the heating tape is meant to protect. So infrared video can actually be a really great method to relay information back for how a system's operating. Use conference calls to perform field inspections and troubleshooting. Ted mentioned how they're leveraging this for audits, and you can see the same technology for an operator to reach out for help. In our experience, what we found is that software that can operate using self-service and does not need Wi-Fi is preferable. You could have a poor Wi-Fi service, or you could have a power failure, or you could have, for example, monitoring wells that are scattered throughout a large property in an abandoned facility, which does not have Wi-Fi access and can't be reached easily. Make sure everyone's using the same platform and the software is preloaded. It's really frustrating if software is incompatible or you have to download something at right when you want to use it. At that point, we've used Microsoft Teams, Zoom. Not advocating for either one, but we've had a lot of experience using those two, and they've worked well. And there have been some really unexpected benefits of this communication method. For one thing, all issues are time-stamped now, so you can go back and look at the progression of events as they occurred. And you get photo documentation. So when you're looking at this in the future and you're troubleshooting this in the future, you've got some time-lapse photography almost to rely on. And it's really easy to take some of this information that comes back from video streams and from photo streams and shoot that off to vendors to say, hey, this is what's going on with my system. Can I get your help to fix that? Next slide, please. I'm going to talk about a little bit about what's coming down here. So in the near future, there's more exciting technology that's coming in. Andy mentioned reliance on next generation compliance. That's been something that's EPA has talked about for quite some time, where they will be reduced enforcement in compensation.
Did we lose Rajiv?
Sorry about that. I have another mute button. Okay. The new buzzwords that are coming through in here as well, there are two items in here. One is augmented reality and the virtual reality and mixed reality. Kind of neat things that are coming through. I mean, I use YouTube regularly to figure out how to repair equipment because someone somewhere seems to have posted a video on how to fix something, but that's uncurated content, so it should always be used with caution. You're not sure if the person posting the video knows what they're doing. Equipment manufacturers are now coming up with equipment manuals that use augmented reality. I use my cell phone to get these pictures on there. This is a demo app on an Android system. And this is really cool. You point your phone at the truck tire, and it walks you through which tool to use next and what to do next, and how to take the lug nuts off, and etc. So this is going to come down the pipe here for a lot of the equipment and help with troubleshooting and repair. Location-based AR, augmented reality, that combines GPS with AR, and some of you might be familiar with Google Maps had a beta version of this where you could point your phone towards a building and it would tell you where to go next. It would understand where you were and where to go next. This has actually been used to locate wells in thick brush. It's been used to define excavation boundaries in remediation projects. Something coming down the road here. Computer vision has come a long way. Predictive maintenance is one very exciting and new technology that's being proposed with computer vision. It automatically detects vibration in equipment, for example, and allows for predictive maintenance, allows for pressure buildup to be sensed. And then you have haptic sensors, which is touch feedback. So when your phone vibrates when you hit a button, that's a haptic sensor. It provides you tactical information. Gloves that are coming out now will provide this information back into the system. So as we look forward to designing systems in the future, and we take into the possibility that we may have situations similar to what we're experiencing now with COVID-19, a little bit of pre-thought and pre-planning along these lines would allow you to quickly get back online and operate remediation systems in the future. That's all I had. Thank you very much.
Thank you. And this is Andy again. We were ambitious in how much we were going to try to cover today, and so we have run a bit over. We appreciate your patience. We do have some questions, and we will reach out to those of you who gave us a question. So we will address them. If you would like CLE, please note the attachment on the right side above the screen where you type in your questions. If you want to apply for credit, you will need to print and complete the attorney affirmation form available in the handout section on this website. You will also need this code. The code is EH&S 716. EH&S as in Environmental Health and Safety 716. If you have there's instructions on the form. If you have any questions, reach out to any of us or Diane Weber, who will help you. In closing, I want to thank all of our speakers, particularly Carrie and Scott, for taking time out of their schedules. Thank you for attending, and you will receive a short survey immediately after today's webinar. Please take a few moments to complete it. And remember, if you want CLE, you must complete and submit the attached form to us as directed. The code, again, is EH&S 716. Thank you very much, and have a great afternoon, and stay well.